Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Have you ever heard about fatty liver? One of the leading causes of liver failure in the United States. It is believed that in the United States, there are 100 million people with fatty liver. Do you have fatty liver? Or do you know someone with fatty liver? I'm Dr. Cooper Dockery, and welcome to Get Healthy. Get Healthy is a program designed to educate you, the viewers, on how to live a healthy lifestyle using lifestyle modification and thus prevent chronic diseases, reverse chronic diseases, or even cure chronic diseases. So I'd like you to sit back and relax as you listen to this disease that you probably have, fatty liver. I have on my show today Mr. Jose Matrier. Jose Matrier is an RN, but he has dedicated most of his life teaching and empowering people to use lifestyle modification to prevent and reverse chronic diseases. Jose, welcome to the show, Get Healthy with Dr. Cooper.
Hello, Dr. Cooper.
It's a pleasure having you, Jose.
Oh, thank you. I'm
Jose,
very happy to be here.
Very good. Tell us a little bit about yourself. Tell the viewers a little bit about yourself.
Okay. Like you said, Dr. Cooper, I'm a registered nurse, and I currently work as a certified wellness coach. And like you said, I help people change their lifestyle so they can live happier and healthier lives.
Very good. So we have a very, very vital topic today, and that is fatty liver. You know, in my practice, I see a lot of patients with fatty liver. Have you ever coached anyone with fatty liver?
Well, when I was going to RN school, I did about 7 months in a mental health institution, and there were several people there with fatty liver, and we'll probably get into it a little bit because we're going to talk about nutrition, which is really one of the main causes of it. But there's something else that I would like to talk to you about today, and that's about emotions and how emotions affect the fatty liver.
That's interesting, and I'm sure a lot of our viewers would like to hear about emotion and fatty liver.
Yes, absolutely. So if they stay tuned, I'm sure they'll be in for a surprise.
Right, right. You know, right now, the leading cause for liver transplant is hepatitis C. But statistics show that there's so many patients having fatty liver nowadays that in 2020, then fatty liver will be the #1 cause for cirrhosis and then liver transplant.
Yes, absolutely. As a matter of fact, right now it's starting to overshadow alcoholic fatty liver.
Imagine that.
So it's very interesting because we've known fatty liver to be just related to alcoholism, but now people that don't consume a drop of alcohol now have this disease.
Right. So
and
now,
that's what we're going to focus on today.
That's right.
Non-alcoholic fatty liver.
Right. Non-alcoholic steatohepatitis or non-alcoholic fatty liver disease.
There you go.
So here we have the body and we have all the organs. Where exactly is the liver?
Well, the liver, you're going to find it on the upper right-hand
side
quadrant, and
so it's
actually right behind
the rib cage.
The rib cage, exactly.
Right. So here I'm removing the liver right here. So this is the stomach and the liver sits right here. Now the liver here has 2 lobes, right? So on the right side we have the larger lobe and then we have the smaller lobe. And right behind here, we have the gallbladder because the liver produces bile that gets stored in the gallbladder, and this assists in the digestion of fat. So what are the other functions of the liver?
The liver is like a mini factory. It has many functions, but I'd like to mention a couple of them. One of the functions that's very important for the liver is that it filters your blood. It filters everything that we eat has to be processed through the liver.
That's right. So
and it also another function is also to produce cholesterol, and there are just so many other functions, and also it helps produce protein.
That's right.
Okay?
So protein that we need to improve our immune system and to prevent infection, some of them are produced right in the liver, correct?
That's right. That is correct.
The liver digests fat. So the liver has some function. We have the exocrine that has to do with digestion of the fat.
Okay, that's another important thing is digestion. And also that's one of the reasons why your emotions when you're angry or when you're frustrated, okay, or when you're being unforgiven, one of the first things you notice is that you lose your appetite or you have a bad digestion. Okay, it's because it's cause of your emotion, which affects the liver. And then, as we know, the liver is the one who produces the bile.
That's right.
Okay, which is stored in the gallbladder. Okay, and then helps with the digestion, especially fatty foods, right? Or grease. And but when you are emotionally unstable, you're going to affect
the liver.
Many diseases and poor health conditions that we suffer come as a result of not taking good care of our body. Dr. Donna Cooper Dockery is a certified internist that will take care of your health. Are you suffering from diabetes, obesity, high blood pressure, sleep apnea, chronic pain, or any other disease? Trust your health in the hands of Dr. Donna Cooper Dockery. She and her great medical team will take care of you. Call today for an appointment. She is waiting for you.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
If you have a cataract and it's interfering with your daily activities, then it's a visually significant cataract and we can do something about it.
Call now, 661-UC, that's 661-8733.
So here we have a normal liver, smooth, we can see that there. And then here we have this one. This is obviously fatty liver. So the difference is that actually, what is fatty liver?
Okay, fatty liver is when 5 to 10% of it is composed of fat.
Right.
Then you are considered to have
fatty liver.
So
usually a patient might be asking, are there symptoms?
That's right. You know, in the beginning stages, there are no symptoms.
That's right.
So many people right now may be suffering of fatty liver.
And they don't know it.
Don't even know it.
Right. So how do we usually diagnose fatty liver if there are no symptoms?
Well, basically you would go to, and most of the time you find it by going to a doctor for just a normal physical or something else. And then they may run a blood test and see that your liver enzymes are a little on the high side.
Right.
Okay, so that may prompt them then to send you for
the sonogram or CT scan or MRI. So usually it's just an abnormal blood test.
Exactly.
And then with the sonogram, we can see enlarged liver and we see that might indicate fat. And we usually don't necessarily do a biopsy. So there are no usual signs and symptoms initially?
Initially, now as it starts progressing, then the person might feel weakness, might feel nausea, actually might have swelling of the legs,
Okay.
Abdominal swelling.
That's when it's now gone into liver cirrhosis. Here we have the stages. This is the healthy liver, nice and smooth brown, and we can see the changes here with the fatty deposit in the liver. And then from this stage, we have scarring. So scarring affecting the liver. Here we have cirrhosis. And you know that from here, then, the symptoms that you just mentioned, the swelling, the enlarged abdominal GERD, right? Redness of the palm, yellowness of the eye.
Yes.
Patient might become a little lightheaded, confused, and so forth. And liver cirrhosis can also lead to liver cancer. So a benign problem like fatty liver can lead over here to liver cancer.
First of all, it starts mainly because of our way of eating, our lifestyle. That's the main thing. And since it was caused by our lifestyle, our way of eating, then we would need to
use
just
food.
Simply
Use food as medicine.
Exactly. Use food as medicine.
I came to Dr. Cooper. I had diabetes. Within maybe 2 months, I was doing better. I'm off my medication. I continue to do exercise and follow a diet.
Once I started to learn better nutrition, I benefited tremendously. I was surprised at the information that was brought out.
I could be healthy emotionally, physically, mentally. She's interested in my health.
For more information, call us at Cooper Wellness and Diabetes Center.
You know, I have Adrian on the road trying to get some questions from the people that he meets, because I'm sure that a lot of people do not know about fatty liver. So I want to bring Adrian in right now to see what questions he has for us. All right.
Dr. Cooper, I'm here with Diana, and she has some questions for you.
Yes, Dr. Cooper. I would love to know what are the symptoms of fatty liver?
So Diana wants to know the symptoms, and we just mentioned that. Initially, no symptoms at all. The patient will feel healthy, patient will go to the doctor, maybe for a routine exam, and then the doctor will probably find what we call abnormal liver enzyme study. And from there, the doctor will order sonogram, or if needs be, CT scan, but usually with a sonogram, that's enough.
Would be suffice.
Exactly. So initially no symptoms, but as you said, as the disease progresses and become now hepatitis or cirrhosis, then the patient can have more significant symptoms like yellowing of the eye, white stool, dark urine, redness of the palm, drowsiness, and fatigue and tiredness.
Dr. Cooper, I'm here with Mike Sanchez. He has a very interesting question for you.
Yes, I'd like to know how I could prevent this disease.
All right. All right, I'm going to give that question to Jose.
Okay.
How can you prevent this disease?
Yeah, good question, good question. As we said earlier, it's a lifestyle disease. So you started it, you initiated it with the wrong lifestyle, let's say, and sometimes not even knowing it. So you can just reverse it with just some changes in your lifestyle. And that starts with our nutrition, because one of the main functions that we said of the liver is processing everything that goes
comes
through
in the mouth. But let's talk specifically about food that can lead to fatty liver.
Okay.
All right?
Yeah. Well, sometimes we think that you have to really have a terrible diet, but not necessarily. Not necessarily. As if you're just the type of person that does not like, for one reason or another, to consume whole foods, you know?
But what are whole foods?
Whole foods are those that come from nature, that come from trees, that come from the ground.
Unprocessed.
That's right, unprocessed, as unprocessed as possible. That's what you want.
Also, Jose,
Yes.
a diet high in fats, animal products, fried foods, red meats.
Yes.
A diet high in high fructose corn syrup.
Yes, yes.
A diet high in sugars. All that can lead to obesity.
Absolutely,
Okay?
absolutely. Who's at risk? I mean, if you're a type 2 diabetic, you're very high risk. If you consume like you just heard the doctor say, if you consume fried foods or on a very regular basis, okay, you're a very high risk for fatty liver disease.
Right.
And
if you're obese,
if you're obese,
that's it.
That's like 95% high risk level.
Right. So obesity, type 2 diabetes, high cholesterol, high triglycerides.
That's right.
All that can increase the risk for fatty liver disease. So how do you prevent it? If you're overweight, just losing 7 to 10% of your body weight will significantly decrease your risk or even improve the disease.
Yes,
Okay?
absolutely.
If you lower your cholesterol, for example, if you start to consume foods that we have right in front of us here, so we have a lot of fruits and vegetables. These are just fantastic because we have no cholesterol here. These are low carb, so you're not going to gain weight from here. So consuming all these here will lower the risk for fatty liver disease.
Yes, and another thing, Dr. Cooper, also you want to go into high sulfur foods, which are like you have garlic.
Yes.
Okay, and if you have cruciferous,
right,
as far as
that's broccoli, cauliflower, kale.
Yes, exactly. What it is with high sulfur foods, even though they say eggs are high in sulfur, but I tend not to go in too much into animal products because the way they are treated today is not the same as before.
Right.
But if you stick with those with the high sulfur foods, basically it raises your glutathione levels.
Right.
Okay.
Right.
And then that glutathione is an antioxidant which will help reverse your fatty liver much quicker.
That's right. And you mentioned garlic,
onions,
turmeric.
Oh yes, absolutely.
Because those are anti-inflammatory food.
That is
and
correct.
Here at the Wellness Center, we have the turmeric sunrise. This is an anti-inflammatory, and this is going to help to protect the liver cells and then help to prevent.
Absolutely, Dr. Cooper.
And on this side, we have a lot of nuts and seeds and legumes, high in protein, high in fiber, but not high in cholesterol. So this can protect the liver.
Dr. Cooper, I'm here with George Galindo, and he has a really interesting question. How do you treat a fatty liver?
All right, so treatment of fatty liver. First, we want to prevent the fatty liver.
Right.
But how do we treat it? By changing lifestyle. Eating healthily, reducing the fat, the fried foods, the processed food, lots of plants, and decreasing the intake of animal products. And if you're overweight, then lose weight.
That is correct. Also, another thing, read the labels. You want to stay away from GMOs, genetically modified organisms. You want to stay away from MSG, monosodium glutamate. Okay. And trans fats
and high fructose corn syrup.
Anything that says hydrogenated or partially hydrogenated, okay, you want to stay away from that. The thing is, we're consuming them on a regular basis and don't even know that we're consuming it.
The last question was very interesting. How do we treat fatty liver? Currently, the medical community is trying right now to find a cure, to find pills. But we know that lifestyle modification, that's the treatment for fatty liver.
That is correct.
So as you are watching us today, remember fatty liver is a lifestyle disease. Fatty liver can lead to hepatitis, can lead to liver cirrhosis, can lead to liver failure, the need for transplant, as well as carcinoma. So as we discussed, today, the treatment, the prevention is the same. Change your lifestyle, eat differently, and you will prevent fatty liver. Jose, any last minute words from you?
Basically, that's it. Lifestyle is what caused it in the beginning, and lifestyle is your answer to the cure.
That's right. Jose, thank you so much for joining us. And I hope to invite you back in our next show.
Thank you.
Don't go away. We'll be right back with more on fatty liver.
Many diseases and poor health conditions that we suffer come as a result of not taking good care of our body. Dr. Donna Cooper Dockery is a certified internist that will take care of your health. Are you suffering from diabetes, obesity, high blood pressure, sleep apnea, chronic pain, or any other disease? Trust your health in the hands of Dr. Donna Cooper Dockery. She and her great medical team will take care of you. Call today for an appointment. She is waiting for you.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Welcome back to Get Healthy with Dr. Cooper. As you know, the aim of this show is to educate you on how to use natural remedies for good health: exercise, nutrition, stress management, water, and the sun. Today we are in our Living Active segment, and we have something very special for you. Ramsey, welcome. Tell us what you have for us.
Dr. Cooper, thank you for having me. What we're going to have is aquatic exercise. This benefits elderly, this benefits the obese population, also diabetics, and also a good way to start into exercise. If you haven't been inactive lately, it's a great step to get going, get everything going. So what we're gonna start with is an A skip. We're gonna come here straight forward, nice and simple. This is a simple demonstration. This is the advanced demonstration right here. So the advanced demonstration is just gonna have that knee come up a lot faster and thrust it way up, boom. Boom, each time. They're gonna be coming down and back, down and back. Same thing, boom. Nice and controlled, nice and controlled. There you go. And we notice how the advance is bringing that knee high, making that water splash. Don't be worried. It's just we're getting that work done. Now here we're focusing on the ligament activating coming up and down, okay? So now we're gonna do the B skip out. The B skip out is just gonna pertain of you pretty much kind of like kicking the door down, nice and controlled. The basic portion is just gonna do it as you can, nice and controlled, the way she kicks out, focus on that knee driving up. Now in the advanced section, now she's gonna do it with a little bit more arm movement and a little bit more oomph behind the kick. Now she's really kicking the door down. Bam, bam, there you go. Getting it done, getting it done. There you go, there you go. Good job. Notice how the advance is really thrusting that knee up, thrusting that knee high. Good job, good job, good job. Now what we're gonna get into is the high knees slow and high knees fast. Here in this segment, I want the basic just to go nice and controlled. Now pick it up, a little bit faster, a little bit faster, 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 pick it up. Do as much as you can. Now the advanced section, we're gonna distinguish the big difference on the speed. Slow and fast. Let's go, let's go. Nice and slow, nice and controlled, nice and controlled. All right, now pick it up, boom, 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 slow. Nice, 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 fast. Pick it up, boom, 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 boom. Now she's gonna bring it back the same way, doing the same thing. Let's go. Bring it back, boom. Fast, 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 slow. There you go. Fast, 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 fast. Finish it, slow. Good job, good job. Hey, they are working, don't believe it or not, they are working. All right, so now we're gonna go into the side step, right? The side step, the basic, we just want you to go, just walking sideways, involve the core, start working that side leg muscle, and just nice and controlled. Open yourself up, don't be making small steps, make big steps. Big, wide steps. Over here in the advanced portion, we're gonna stay low. We're gonna stay low and open up. Boom. Open up. There you go. Stay low, stay low, stay low. Now you notice how the basic is just coming nice and smooth, nice and smooth. Good job. Perfect, perfect, perfect. Stay low, stay low, stay low, stay low, stay low, stay low. There you go, there you go. Come on in, Dr. Cooper. I hope you like this segment.
Wow, Randy, I just love this segment. Now you out there, if you're elderly, if you're overweight, you're disabled, this is your exercise for you. Randy, thank you so much, and we'll see you again soon.
Cooper Wellness Center now offers a wide variety of vitamins and nutritional supplements. Omega-3 protection for the brain. Coenzyme Q for your health. Turmeric, the wonder supplement, great for joint pain. Vitamin D3 to promote healthy bones, plus many more multivitamins for women and men. Find these quality non-GMO supplements at great prices online or at Cooper Wellness Center. Live healthy, live smart.
Welcome back to Get Healthy with Dr. Cooper. Today you've learned a little bit more about fatty liver and realizing that fatty liver is a disease that is preventable. And if you have early stages of fatty liver, then you probably are time to improve or even cure your disease process. What do you have to do? You must first change the lifestyle. You need to change the way you eat, consuming less animal products, removing fatty foods, sugar, high fructose corn syrup, exercising, maintaining a healthier weight, and lots of green leafy vegetables, including garlic, turmeric, and onions. These are foods that will protect your liver from inflammation. And remember that if you're already in the late stage, whether it's liver cirrhosis or cancer of the liver, there is still hope. God, our Creator, will give us hope. He wants us to be healthy. In 3 John 2, he said that above all, I wish for you to prosper and be in good health. So don't be discouraged. Hope is on its way. So I would like you to follow us. Watch us same time, same station next week. And may God continue to bless you and your family. I'll see you again soon. Bye-bye.